beautiful people on YouTube. My name is Clayton and thank you so much for joining my channel today. Hey, if you haven't already, please subscribe and turn that notification bell on as well. You'll be notified every single time that I post a new video. And do me this big favor, like this video. It helps this channel out tremendously and that YouTube algorithm to get this video out there for people who may need it. So if you could do that for me, I'd greatly appreciate it. Today we're going to be talking about anxiety medication, and this could be a whole range of things. Now I'm going to go ahead and dive right into it because I really find this interesting. So when it comes to anxiety, of course there are a lot of medications that doctors and therapists use to help with anxiety disorders. The most frequent would be the SSRI. Now, if you were to kind of dumb it down and put it in English, it would be a selective serotonin reuptake inhibitor. What that does is serotonin is a neurotransmitter. It's in your brain, right? So it pretty much, when you take that pill is going after that serotonin in your brain and disrupting your brain might have trouble sending messages back and forth. So it disrupts all that and it puts more serotonin in your brain and it treats depression and anxiety that way. You probably heard, if you are dealing with some type of chronic anxiety or depression, you have a chemical imbalance, and that's pretty much all that it means. With the serotonin, you're not getting enough serotonin in your brain. So the neurotransmitters are, going back and forth between the brain cells, and it's not working properly. Now, there are a lot of common symptoms with SSRIs, but normally when a doctor or a therapist prescribes this, the risk of the side effects are not as, it's all about risk and reward with the whatever medication you take. The risk of the side effects compared to your mood, right? Compared to your anxiety. Is it treating your anxiety? Is it treating your depression? Based on having dry mouth, fatigue, even diarrhea. Don't want to talk about that, but diarrhea, stomach issues, nausea. Those things are really common with SSRIs. Now, the next medication that's really common is the benzodiazepines. Now, of course, these are very, very limited, given to an average person. Now, this you would have if you are either having trouble sleeping or if you have really, really vicious anxiety. The doctors tend more to prescribe the SSRIs because the benzos, we call them benzos for short because I don't feel like saying the whole word every single time, benzodiazepines every single time. They are very addictive. Now, I know that a lot of people in this country are addicted to some kind of muscle relaxer, to some kind of painkiller, the opiates, the methamphetamines. We have a serious problem in this country, and this can contribute to that problem. The medicine is very, very addictive, and the side effects can be very, very deadly and lethal. And frequently, when somebody is getting off of this medication, it will cause withdrawal symptoms. It will cause a whole range of this feeling very, very sick, feeling like you just feel like death. From personal experience of what I've heard, to withdraw on something like that, you just feel disgusting. You have so many different symptoms, and it's different for everybody. Now, I do want to say that this can be really, really helpful, but you have to go back to the risk and reward. If you have some type of addictive personality, then it's probably not best for you to take some type of Valium, some type of Xanax. It can be very addictive, and it's not really the doctor's first choice when they come and treat, anxiety and depression. Actually, a lot of people end up going to the ER who are addicted to this medicine just to get this medicine. And some people even have the nerve to fake depression, to fake anxiety for that medication because they are addicted to it and they just need more and more and more. And that's never the way to go. Get yourself checked out in a better place. When I first got diagnosed with anxiety, I also had restlessness. I could never get on a proper sleep schedule. I always was either sleeping too much or not sleeping enough. And so there's another classification, and I don't know the proper term for the classification. And a lot of them are used to treat seizures and such. But they also have a soothing effect. So mirtazapine, I believe, is. But when it comes to anxiety medication, of course, I think that it's always smart to talk to your doctor about the risk and the benefits of the medication. And if the risk outweigh the benefits, then it's probably not a good medication to take. Now, if the benefits outweigh the risk, of course, vice versa, it's probably something that you should look into. But I think that's very important, especially with the benzos, you don't want to get addicted to Xanax and Valium and things that can cause severe problems in your relationships and in your friendships, to make everything worse. You don't want to become addicted to that. So if you have an addictive personality, and you do, that's probably not the best option for you to go. Anyways, thank you, Michael. Thank you so much for contributing and commenting in this channel. Guys, if you have any video topics, comment down below. Let me know if you want to talk about anything else. I only have so much knowledge, until we cross lines of me becoming a therapist and doctor and stuff like that. I'm not a doctor, I'm not a therapist, but I could share from personal experiences of what I felt, what I've heard, and how I went about doing whatever I did. So thank you guys so much for watching this channel. As always, God bless, my friend, and I'll see you back here next time.